Good evening. My name is Lisa Rudd. I am a student at UNCW. I'm in the master's degree nurse educator program, and just want to introduce you to an online module that I've created for this course for any learners, whether they be in this particular class or if you're a learner that is a nurse or in nursing school and want to learn more about cardiac nursing. I'm a cardiac nurse. Mostly have worked in progressive care, but also have taken care of CHF patients. Have had a little bit of ICU experience, but mostly progressive care, cardiac. And it's very important as a nurse, whether you're a cardiac nurse or in another area of acute care, to recognize signs and symptoms of a myocardial infarction or MI, and to know important first steps that you could do as a nurse, important interventions and things that you can recognize. And that is my basically my rationale for creating this module and why I think that is important. So some of the learning objectives are to explain the signs and symptoms of an acute myocardial infarction or MI, and that is Bloom's taxonomy comprehension. Second point of objective is to distinguish complications of an acute MI. That is also comprehension under Bloom's taxonomy. Also to select immediate interventions to stabilize a patient with an acute MI. Also, that would be applying under Bloom's taxonomy. And lastly, to create a long-term care plan for management of a post-MI patient, which is creating. So part of this module, I did create a lot of interactive sessions here. Some of them, I guess, will be some PowerPoint information. Some of it will be some instructional videos. I did have some links to some resources that talk about patients that have lived experiences of an MI and what that would feel like from the patient's perspective, which I think is very important. And it does culminate in a quiz as well that would test your understanding, a 50-point quiz. So I really hope that you enjoy this module, and from that, really take a lot of information. I know that a lot of times if you're not in cardiac nursing, a lot of the rhythm strips and recognizing different rhythms and abnormals can be a little bit overwhelming, especially if you don't utilize it every day. So I do think that it is important. I think it's something that the more that you work with and get familiar with, the more that would become of interest to you. And a lot of times that, what I've noticed is that working on a cardiac floor, a lot of times I encounter patients that have a lot of other illnesses and complex pathologies that are non-cardiac and then vice versa, you could be on a non-cardiac floor and, it could be on a pulmonary floor and someone have something that's cardiac in nature because they go hand in hand. Even a renal floor, have someone that's cardiac in nature, a general med surge. So it's important that you don't just say, well, I'm not a cardiac nurse, I will never need to know this. So I do think it's very important to sort of get familiar and sort of learn a little bit about what these signs and symptoms are, and especially, heart attacks are, acute MI are one of our top killers, one of our top main health issues that are in our country. So, along with our fast food or high fat, high cholesterol diets is very important. We're all putting ourselves at risk for that to be able to be cognizant of that as both healthcare provider and as well as take care of our patients. So my learning approach that I've used with this is called cognitivism. So basically that means that you sort of go through this material and you construct your own view of what you think is reality. And again, we're all coming at this at different angles with a different perspective, with different backgrounds in nursing. So I do think we construct our own meaning and our own knowledge base based on sort of where we've come from. And I also have links of where you could post questions if there's anything that's unclear, where you can communicate with others in the class as you're going through this module. So feel free to provide feedback, provide questions, provide comments. to indicate what you think is good about the module, what you think can be improved upon it. Again, we're all learning here on how to, in our sandbox, and how to create effective modules so that we all in this class can, our goal is to be effective educators. So let me know, and I look forward to your comments. I hope that you've enjoyed and will enjoy this module I've created, and I look forward to learning about all of y'all's modules. Good luck, and thank you so much.